So if you've ever been brushing your teeth, which I'm sure everybody does, you may notice that there's bleeding. And in some patients' mouths, they notice a very strong odor. And so they come to see us, and it's been, several months or years, and we do an assessment. And this assessment is similar to a blood pressure. We take measurements of the gums that indicates to us whether there's something called gum disease. And what gum disease is when there's bacteria that's left in your mouth and you're not able to reach all the areas of your mouth, in particular underneath the gum, then what happens is that bacteria starts causing inflammation, which is the buzzword right now. It causes bleeding. And, the gums bleed when you brush or floss. And when it's left or it's persistent, patients start losing bone. And when you lose bone, that's something that causes tooth or teeth to become mobile. So these are all signs of gum disease. The goal of our treatment, in essence, and as I mentioned in many offices, it's very uncomfortable, it's very painful. Sometimes patients have to be frozen because it's uncomfortable during the treatment. We actually lecture for a company in Canada and the US on something called soft tissue management. And this is a non-surgical medicated cleaning whereby we're able to treat the disease and have the patient go on medications. And after about 4 to 6 weeks, we're able to resolve the disease and then maintain the patient's health so that this disease does not come back. All patients are candidates depending on the level of disease. Some patients come in and, things are too far gone, and at that point, their only option is removal of teeth. So our goal in our practice is, of course, to maintain the health and maintain patients' teeth. That's our number one priority. And we've been able to, really help patients with that type of treatment. And it's, it's very rewarding experience to be able to be a part of that process for them.